My name is Samantha Mabry. I am a semester 6 nursing student. Right now I'm in clinical and I'm in the psych emerge at the Halifax Infirmary.
My name is Ola Panchal. I'm a semester 6 student in nursing. Currently doing my clinicals as well. Doing med-surg at the Dartmouth General, 3 West.
Well, our first day of school was lab. So our first day of nursing school, period. So when we came in, we were like all kind of wide-eyed and like, oh my goodness, walking onto this floor that was fully set out like a hospital. I feel like that was really like awesome to see, like as it being your first class, because then it's like, wow, like these are all these resources that I'm going to get to use, and like it's all very high tech and definitely more than what I anticipated at least. But yeah, we do sims almost every week now, and yeah, they're really, really interesting to kind of see in a more like run through full scenario as opposed to just learning like an isolated skill, if that makes sense.
Does make sense. My favorite sim with Dal so far has been the sim we did last. For the previous 2 weeks we had a sim, but the first scenario was about a patient who had gotten into an accident, and in that accident the patient lost everyone who was in the car except for himself, and his girlfriend, who was expectant, also died. So this patient has been in the hospital for like 1 month, and he's struggling with feelings of guilt because everyone passed away and he's the only one left. So I was one of the students who was doing it the first week, and when I went into the sim, I didn't expect it to be as intense as it was. So it was a good learning opportunity for me, because it was eye-opening that when you go into like real life scenarios, you have such things happening to people outside there, and it's so scary. And as a nurse, it's really important that you know how to deal with such patients, because how you deal with them and how you talk to them is so important in how they're able to cope and everything, because they're going through so much. So that was one of my favorite sims, and I think the sims are like really amazing because we get to like experience things that happen out in the real life in class, where we have like a safe space, because we have our instructors and our classmates, and you know that if I make a mistake, my instructor is going to correct me, or my classmates who are like my team members are going to chime in and they're going to help me. So I think the sims are like a great learning spot for us.
My name is Kim Haber, and I'm official title right now is the coordinator of the clinical learning simulation labs for the School of Nursing. So I kind of oversee the simulation programming and scheduling and clinical skills programming for both the undergrad and the graduate program at the School of Nursing. So I actually started with the program in 2003, so 23 years ago, and in the fundamental labs. At that time, it was just really skills being taught, and even back then there was starting to be a recognition of students not putting things together. They were being taught like a system and a medication, or how to do a dressing, but it was never tying all the pieces together. So even as early as 2004, I started hearing a little bit about simulation, started kind of attending some conferences where simulations was starting to be highlighted. Simulation has always existed in different programs, like the most common would be aviation. We know you don't get to fly an airplane until you've worked in a simulator for a while. And same with the forces and some other areas too as well. So it made perfect sense for us to create a space where students could come in and start practicing, where they weren't going to be afraid of hurting somebody or having a bad outcome, and not being afraid of making mistakes. So that's what the simulation environment has helped create for them, and that's why it's critical to their training and program. And now it's right across everywhere. There's not too many programs that don't have it. But certainly the School of Nursing here in Nova Scotia was one of the first to really ramp up the program and embed it deeply into the curriculum, so it's threaded right through.
I am Kelly Lackey, and I'm an associate professor in the School of Nursing, as well as the associate director of sim-based education and interprofessional education in the School of Nursing. And as an associate professor, my program of research specifically examines interprofessional education and collaborative practice and the linkages between those, but also woven in there is the notion of psychological safety in interprofessional learning, and especially from an equity, diversity, inclusion, and accessibility lens. So my program of research certainly informs what we do and how we do it in the Sim Lab in the School of Nursing, both at Halifax campus and in Yarmouth campus as well. When we develop Sims, they're very, very intricate, and we do them with simulated patient educators here from the C3LR that work with our nursing faculty to actually write a script. The scenario is very, very well described, and the simulated patients are trained and study that script. So that helps to standardize learning amongst different groups of students, right? Without that, you're not sure that you're going to meet the learning outcomes of that simulation, when you have someone coming in just playing a patient. So simulated participants are integral to both uniprofessional simulation, so within a health profession, and interprofessional simulation. And the focus of that sim or any other sim that is interprofessionally focused is to use that baseline scenario to further develop the knowledge and skills for collaboration while dealing with the patient at hand. Psychological safety is the understanding that I can be vulnerable in my learning. And as a faculty member, I can't guarantee anyone's psychological safety. But what I can do is put in the supports that are necessary and learn, educate myself on how to facilitate conversations that may bring up trauma, past traumas, past experiences. Psychological safety is also that belief that I will not get in trouble, like there'll be no repercussions if I stand up to power. I mean, healthcare is full of power and hierarchy, right? And so I think it's important for learners to be equipped with that, but also in their education system to know that I can disagree with somebody else, whether or not you're the faculty person or another student, in a respectful way. I can challenge predominant thinking. I can ask questions without feeling like I'm dumb. Without embedding psychological safety, learning is negatively impacted.